Hi, my name is Jamie Malik, and I will be discussing my conceptual framework and conceptual model for my topic of interest. My topic of interest is sexual health for patients undergoing treatment for colorectal cancer. Specifically, I am interested in learning more about their sexual health experience in order to tailor education to help improve their sexual health in the future. I'd like to give a little background information about this topic. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. I like this definition because it shows that sexual health is not just about sexual function or sexual dysfunction. There's a lot of factors intertwined that make up sexual health. Sexual health is impacted by physical, emotional, and relationship variables. Colorectal cancer is the third most diagnosed cancer in the United States. Colorectal cancer treatment can impact physical, emotional, and relationship factors for sexual health. Colorectal cancer treatment is usually multimodal, which means that it involves surgery, radiation therapy, and a systemic therapy. These can cause alterations in sexual function, but can also change a patient's mental or relationship well-being. Learning more about the lived experience of patients who are undergoing colorectal cancer in regards to their sexual health will help develop interventions to improve sexual health for this population. I am ultimately interested in tailoring education for this population, but need to learn more about what their wants and needs are for sexual health while they are undergoing treatment. There are some core concepts that are associated with sexual health, and I have broken these down into emotional aspects, physical aspects, and relationship aspects. For emotional aspects, there's a lot of emotions that go on with a cancer diagnosis. Anxiety and fear tend to be some of the emotions that my patients tell me the most about. These can definitely impact somebody's sexual well-being or sexual health because when you're in a state of crisis with anxiety and fear, it may make your desire for sexual health less. However, there is also the emotion of love, love for your partner, love for the person that you are sharing your life with. So you want to share physical aspects with them. And I want to see if this concept is stronger than the fear or the emotion for sexual health. Physical age impacts sexual health. So most people, as they get older, have less drive for sexual activity. However, it is not zero. Fatigue. Fatigue is a big side effect of not only cancer, but cancer treatment. I always tell my patients that fatigue is the one thing that you're going to get no matter what kind of treatment or non-treatment that you do with cancer. Obviously, fatigue can definitely impact sexual health, as if you're too tired for sexual activity, you're not going to have sexual activity. And then there's also the treatment related changes. This is a whole group of things that can change with treatment for colorectal cancer. This includes erectile dysfunction, vaginal dryness, pain with intercourse. You could also have some bowel incontinence, which would make it so you don't want to have sexual activity. So there's a lot of things that change with the colorectal cancer treatment. And then relationship, intimacy. How intimate are you with your patient, with your partner? And that is not just sexual activity, that's also just how are you sharing those moments that are just between the two of you. Relationship issues can also be the partner's wishes, right? Does the partner want to have sexual activity, or is the partner scared, which goes to fear of having sexual activity because they're afraid of hurting you? And then there's also relationship strain. Sometimes when there's a cancer diagnosis, it can strain your relationship with your partner, and how is that playing into your sexual health overall? The theoretical framework that I'm using for my conceptual model is Gene Watson's theory of human caring. Watson's theory of human caring discusses the transpersonal relationship between the nurse and the patient, though this can be translated to any transpersonal relationship. The theory of human caring is a holistic model, so it takes into account the physical, mental, and spiritual connection that the patient and the nurse have, and discusses how you can strengthen that relationship through caring moments. Caring moments are times when the relationship transcends just the business and actually shows the patient that there is care and they are able to heal more fully. The caring moments for this theory will be utilized during the interviewing section of the research, thematic analysis, and eventually the educational interventions. Before I discuss the conceptual model, I would like to discuss the research process for this proposed research because this will help explain the conceptual model as well. So for this research process, participants will journal during their treatment for colorectal cancer. The journaling will have specific sexual health prompts. However, the patients can journal whatever they want while they are on this journey. The participants will then undergo an interview with the researcher, and the journal will be used to help with question prompts. So to help determine what the patient was thinking when they were journaling or what they were feeling, and this will help with making sure that the data is robust and also to make sure that the thematic analysis can help determine the actual thoughts and feelings and lived experience of the patients with colorectal cancer. There will then be a thematic analysis in which the major themes are extracted from the data. The thematic analysis is the end of this research, and in the future, the thematic analysis will help determine a beneficial provider relationship that can be used to improve sexual health outcomes for this patient population. So for the provider relationship, there needs to be trust between the patient and the provider. That is one of the most important things about a provider relationship. So caring moments are definitely important during building trust with the provider. There's also permission. So there is permission not only for the patient to talk about sexual health, but permission for the patient to engage in sexual activities. That permission is from the provider. A lot of patients do not want to do anything unless they get permission from their oncologist, so that is also an important part of this process. And then the last one is education. Education will say what should we be telling our patients about sexual health, what should we be educating them about, what do we want to look for, and determining what is important for this group of patients with their lived experience will help tailor the education to this population. Here's the conceptual model that I developed for sexual health for patients with colorectal cancer. On the left, I divided the three major concepts, physical, emotional, and personal relationships, and then those all go into sexual health because all of those together are intertwined for sexual health. Sexual health will then be determined by journaling by participants, which will then go into the interview with the researcher. At this time, the caring moments and the transpersonal relationship is very important as we want the participants to feel as though their voice is being heard and feeling as though there is a connection between them and the researcher. The interviews will then go into thematic analysis. This again will utilize caring moments because caring moments are important when we are thinking about our relationship that we have with this participant and making sure that their voice is heard and that we're understanding their actual lived experience. And then major themes will be extracted. This is the end of this research, but how I visualize this research continuing in the future is by determining the provider relationship that will be most beneficial for sexual health for this group. And this, as we discussed at the previous slide, will include trust, permission to talk about sexual activity, permission to engage in sexual activity, and then education tailored to this group. And it's very important that caring moments are used with the patient during this time so they can feel as though they have a beneficial relationship that is trusting with the provider. And this will help with sexual health and help improve sexual health overall. That is the conclusion of my conceptual model. These are the research references that I used for my research. I hope you enjoyed learning about my conceptual model, and if you have any questions, I look forward to hearing them. Thank you.